Hello. Our grand challenge was to reduce extreme economic inequality. I'm Allison Cardwell.
I'm Andrea Abrams.
I'm Cameron Fonashir.
I'm Maria Medina.
And we have Estefania Zapita. Can you go to the next slide, please, Maria? So community practice employs the values of empowerment-based interventions to strengthen participation in democratic processes, reform human service systems, assist groups and communities in advancing their needs, and organize for social justice. And I got this from our modules. Next slide, please. So, summary of our grant opportunity. Our grant is called Investment in Mental Health Wellness Grant Program for Children and Youth. It is funded by the California Health Facilities Financing Authority, or the CHFFA. The goal of the grant is to provide assistance with crisis stabilization to youth in regards to their mental health, as it applies to children and youth up to 21 years old. The data was collected from the grant. There were 3 distinct areas that could be applied for, and the one we chose was for a mobile crisis support team. Next slide, please. Individual counties applying jointly, nonprofits or public agencies applying for their county could all apply. The funding was based on current population of the county as well as the region you were based in. That data was gathered from online sources as well as from the grant regulations itself. For the team members gathered for a mobile crisis support team, articles were researched and the average used. Next slide, please. Pages 3 through 4 was the summary information. Those who were applying, we used Cameron's agency of Penny Lane Foster Agency, and that data came from Cameron. Pages 5 through 8 was the budget. That data was gathered from various online sources such as Indeed.com, Glassdoors.com, the US Census Bureau, and articles that were gathered and that utilized mobile crisis support teams and compared. And now I'm going to turn it over to Maria.
And the mobile crisis support team that was to be used was supposed to serve the agency of Penny Lane. Through this agency, the crisis support team will serve as a non-emergency mental health crisis resource for vulnerable youth in Los Angeles County, ages 21 and under.
All right, so my responsibilities were to find key findings or identify key outcomes and plan for measuring them. So for how I found out was through literature review. I conducted a comprehensive review of existing literature, studies and research related to mobile health support teams, crisis interventions, and outcome assessments. I looked at studies that evaluated similar programs and their impact on hospital and psychiatric utilization. And one of the articles I used was the Justice Center. That's the primary one I used for most of this information, which helped me find law enforcement records. You could look up law enforcement agencies within the SPA 7 area in which we were kind of doing a lot of our research. We were able to find mental health crisis calls, contact, custodies, transports for assessments before and after the program launch. So for program records, when in progress, obtain partial data from the mobile crisis support team program records, including the number of participants enrolled in their demographics. Another way we could find key outcomes is through surveys and interviews. So we were able to kind of make up a survey and interview protocols to gather qualitative and quantitative data through families and significant individuals that were part of the crisis team, the individuals, the clients. And another way you could find Key outcomes is through healthcare facilities. So collaborate with hospitals, psychiatric facilities, and emergency rooms within the SPA 7 area to have access to emergency room visits and psychiatric inpatient services. Next slide, please.
My effort was to find working relationships with related supports, as well as expanding community-based collaboration designed to expedite services. I researched the services Penny Lane offers, which can be found on pennylane.org. They offer community programs, family programs, housing programs, mental health services, and in-home programs. In addition to Penny Lane, I researched the mobile response team already available in Los Angeles County, which are the psychiatric mobile response teams, which can be found on lacounty.gov through the Department of Mental Health. And I found through researching both LA County supports and the extensive relationship Penny Lane already has. In addition to the mobile response teams, the county has in place the Los Angeles County Office of Education has partnered with LA Care Health Plan and HealthNet to offer telehealth services to LA County's 1.3 million public school students at no cost to their families. You can find that at ca.gov under the Student Behavioral Health Program. Next slide, please.
Okay. Our readiness for our mobile crisis unit, it would go through a various of approvals. First, it will go through the County Board of Supervisors, the Department of Mental Health, the Board of Montevideo Unified School District, Los Angeles County Sheriff Department. It would also go through the LA County Parks and Recreation Centers, as well as the California State Department of Mobile Vehicle. That way we will get our mobile vehicle registration, car registration. Our mobile unit would consist of different professionals, licensed clinicians, MSW interns, volunteers. They would all have experience in behavioral management, nonviolent intervention, solution focus, interviewing, motivational interviewing, crisis intervention. Penny Lane will provide the training for our staff that can be equipped with the necessary resources that we need to provide for our clients. And we would also have staff who would be bilingual, so we can serve those who are Spanish speaking. Some of our SMART goals that we will have is will be a full range of services to help with mental health and also substance abuse disorders. Our service will be ready for immediate intervention to assist our clients as needed. Based on our collaboration with the Department of Mental Health and Penny Lane, we will give access to available long and short-term resources. And this information, I got it from Penny Lane website. Some of the specifics would be, our goal is to reach at least 3,500 children, youth, and family per month. We will be measuring our goal based on the amount of insurance that we get monthly and daily as well. We plan to achieve our goal through advertisements, community outreach, flyers, community workshops, presentations. And our goal would be, it's very relevant to our values, and it aligns well with the objective to reach as many families as we can and as possible. It would open the access to many families who don't have access to a mobile crisis around their area. And we intend to achieve our goal within 6 to 12 months.
Yeah, I think next slide, Maria. So the line item budget, narrative, and job descriptions were compared in salaries. That information was all gathered partly from some information that Cameron provided from a fiscal statement of the salaries paid at Penny Lane, as well as compared with salaries that are paid from all the people that would be hired for the mobile crisis support team, both compared in the LA area and around California. And then a medium was used for our projected people that we would hire.
So in terms of sustainability, there was a description of funding and how existing funds from host agencies might be redirected from provided or by researching articles. You can go to the next slide and I could kind of address some of this stuff, please. Thank you. So to just understand sustainability, I tried to use like a law to kind of understand some of the lingo from the application. I used the Law Insider, how to word some of the stuff. So in order to kind of provide sustainability, Penny Lane would have to obtain the most recent audited financial statements. And then these statements should be provided a comprehensive overview of the organizational financial position, including assets, liabilities, revenue, expenses, and retained earnings. And then you provide a credit rating information. And then with that, you'll be able to show sustainability. And then the quote underneath is just kind of like how one would word it in the application. Next slide.
So the first part of the equity audit, part of this was answered from the grant itself. The history of the funding source related to the grant challenge came right from the grant. Who's left behind? For-profit organizations are left behind. Individuals over the age of 21, children and youth not deemed as having a crisis, and children who are not contracted within Penny Lane's service contract. Next slide, please.
To continue with the audit, are equitable and inclusive, is it equitable and inclusive of smaller organizations?
Equity audit?
Yes. I believe this is my portion,
It is.
right? Okay,
Yeah.
so it is inclusive of smaller organizations because they are able to apply. However, only county organizations are able to be the lead grantee. Therefore, this impacts the amount of funding smaller organizations may receive in comparison to county organizations. Does it meet the needs of organizations serving multiple marginalized communities at promise communities? The grant may be used with organizations of the state of California that serve multiple marginalized communities in multiple ways, such as organizations that serve foster youth with mental health, housing, and employment resources, such as what Penny Lane does. However, this grant can only be used for individuals under the age of 21. Therefore, it excludes individuals over this age that may need help with that may benefit from the grant. And I believe that's it.
Thank you.
Thank you.
References.
Yeah, reference pages there as well. Thank you so much.
Thank you.